So the COVID-19 pandemic put incredible strain on our healthcare sector here in Canada and exacerbated the already growing waiting list crisis in our hospitals. Some had elective surgeries delayed for years, while others had life-saving surgeries cancelled at a moment's notice. Jessica Bailey from Saskatoon in Saskatchewan was one of those unfortunate people subject to the government's mandated cancellations in the province. And she joins me here today. So Jessica, thank you so much for joining me. I really appreciate you being here.
Yeah, thanks for having me.
So Jessica, your situation is incredibly unique. I would argue one of the most unique stories we've covered here at secondstreet.org. Your kidney transplant was cancelled last minute because of a government mandated order to delay surgeries. Can you tell us a little bit about the background of how you came to be in this situation today, from when you were diagnosed in 2018, I believe, to where you are right now? Can you give our viewers a little bit of background of your story?
Well, I was perfectly healthy and I felt fine. And I discovered, like you said, in 2018, I got a kidney biopsy and was diagnosed with kidney failure. I only had 20% at that time. In the last 3 to 4 years, it's degraded to, maybe 1 or 2% kidney function that I have now. So I depend on dialysis for life-sustaining support. Basically, my best friend's husband was kind enough to be a live donor for me. And we went through all the steps. It took us about a year to get all the tests and steps done. We both had the green light for a surgery. I was about 2 weeks away from my OR date. And because of the COVID crisis and the healthcare crisis, ultimately, it got canceled. In the meantime, he developed kidney stones and disqualified. So I no longer have a donor. So now I'm back to square one, trying to find, a match.
Yes, it's tragic to hear. So just for our viewers, just a sort of summary for our viewers. Obviously, you found out you had an issue 2018. You went through the long process of trying to find a donor. 2020, you found a match in your friend, and he was willing to give you his kidney. 2021, then you had a surgery date, and then of course it was just cancelled. So you've been effectively on this long road, this waiting list for give or take 4 years. Is that a fair summary?
Yeah, absolutely.
Right.
Yeah, it's been really hard. I've went through many complications. Like I was on have a PD catheter. I was on peritoneal dialysis, and I was getting lots of infections and whatnot. So that led to having to remove it, a surgery that was supposed to be a day surgery and got botched. And it basically, they nicked an artery and it caused me about 5 weeks in the hospital being bedridden. And now I'm trying to get back to the point where I'm even healthy enough to receive a kidney or get back on the list. So it's been a long journey for sure.
It's been an ordeal for you to say the least. And that's an understatement in saying that. So, and then what was their reason for cancelling the original surgery, Jessica? I know they said COVID-19, but was it because of a lack of hospital beds? Was it because they were worried about you getting the virus in hospital? Were they worried about the staff? Was it a shortage of staff? Did they provide any sort of clarity as to why specifically they cancelled that surgery?
Well, basically it was due to staff redeployment and needing those staff from the transplant program to go to ICUs due to, the overcapacity because of COVID. So basically they took these nurses that are supposed to be coordinating transplants and they put them in the ICU. And so that just completely nullified the program. Like it was completely shut down to the point where even cadavers, people that were going to donate their organs, people who were dying in that meantime, basically their organs were getting wasted because of the program being shut down, which I think is really sad.
It's incredible. I mean, it's another conversation for another time, but of course, some will say, of course, well, okay, that they had to shut down the program because of COVID-19. Others will say, well, with people in your situation critically ill, like was Was there a need for it? And again, that's a conversation for another day. I mean, who knows? We'll have to dive into that deeper. But how did it make you feel? You were so close to having the surgery. How did it make you feel having that opportunity taken away for you, for the government to then say, well, sorry, we know you're in this critical situation. We're just going to have to, delay it or cancel it. Like what sort of emotions did you feel on the day?
Complete devastation. Like I just wanted to give up at that point. It was like they took away the only light there was at the end of the tunnel, for waiting so long and going through so many complications and it taking a year even just to find or to get a match. Once I had somebody, it just seemed like all the hope was completely ripped out from underneath me. It was devastating.
No, understandable. And myself, and I'm sure, 99.9% of people watching this can only imagine the heartbreak you must have felt with that. And what was the effect on your family as well? Because obviously, you've probably got a very good support system with your family around you right now. What sort of emotions did they feel? Like, how did they feel knowing that you're going to have to be on this waiting list a little, a while longer?
Well, definitely as devastated as I was. I know my mom took it really hard. There was a lot of anger due to just like the system and how things were panning out, and like to be literally 2 weeks away from getting a kidney to now I don't even have a donor was just unreal, It was devastating for sure.
Yeah. And so to talk us through an average day for you. So, obviously it would have been great if you had the kidney transplant as originally planned, but obviously things would have looked a lot different for you right now. But right now, as things stand, what does an average day-to-day look like for you? Like talk us through, or even an average week, if you like talk us through the average week of Jessica Bailey. Like, what does that involve in terms of medications, rest, dialysis, things like that?
Well, I'll take it through a weekly kind of thing. Monday, Wednesday, Friday, I have dialysis for 4 hours a day. Typically on those days, it's hit or miss whether I have a migraine and vomit for the rest of the day because dialysis is just really hard on my body. I take about 25 to 30 pills a day. And now, since the surgery that I had, I have developed ascites. It's like abdomen fluid buildup, and which is now keeping me off the deceased donors list as well. So that's a new problem that we have to figure out. But basically, on Thursdays now, every Thursday, I get about roughly 5 liters of fluid pumped out of my system. So I'm at the hospital 4 days a week. Typically, I take a lot of pills and I have a very strict diet. If I get high potassium or phosphorus, like my bones ache and my legs ache. Like like at work, I used to take like 20,000, be doing 20,000 steps a day. Now I'm lucky if I can do 1,000 steps a day. To put it in perspective, I guess, of how the extreme fatigue is when you have kidney disease. It's debilitating. It's just like I don't have a life like I used to have, and I'm just excited to get one back if I can get a kidney.
Totally.
Obviously, but basically, I rest a lot. I'm in bed a lot. After the month of being in the hospital, bedridden, I lost a lot of my muscle mass. So even like standing in the shower, I have a seat that I could sit down now because I just don't have the strength anymore. So basically, it's just a lot of rest and pills and hospital visits.
Yeah, a complete 180 to the life you probably used to live, I imagine, before this all
Yeah, I
happened.
was very athletic before. Like I played every sport I could get my hands on. I played hockey for 25 years competitively, and and like I said, I've always worked labor jobs, and I was strong. And this disease has definitely broke me down for sure.
Understandably, yeah. And I guess it's tricky as well, I guess, because it's not like you're a regular patient, if I could use that word. I mean that in the sense of the sort of the system behind it, in that it's not just you need, surgery and the government can provide it to you. Yours is kind of twofold, in that you require the government to give you the operation, or the healthcare system to give you the operation, and you also require a donor to become available. So, I know you said that you had a donor originally, and then, sadly, he came down with kidney stones, I believe you said, and of course that sort of nullified him from being in the process. What's the process like to locating another match? Like once those kidney stones from that individual, your friend, once they're cured, can he now be put back on the list, or do you have to start right back at square one? And if you do have to start back at square one, are you any closer to finding a match right now, or are you still in the search process?
I'm in the search process, and he is completely disqualified. He can't, even after either passing or his stones dissipating, he is not allowed to try out again, and probably will never be able to give an organ donation now, like for his kidneys anyways. They completely disqualified him, and now I'm in the process of trying to find somebody, but like I said, they won't even allow me to be on the deceased donors list due to now my ascites of getting this fluid pumped out of my abdomen. Before it was an infection, because if you're on any antibiotics or anything like that, they won't allow you on the list. So the list isn't really a list. It's kind of like factors that you have to meet in order to get on or the list. Like usually it's how long have you been on dialysis? What stage are you in? Like I'm stage 5, obviously. And if you're healthy enough ultimately. And the catch-22 is the longer that you wait, the harder it is, because you're getting sicker and sicker, so you're more unhealthy. So the harder it is to get on the list. So, I mean, a live donor is my best bet because of all those things, but in the same sentence, I still have to be healthy enough to receive the transplant.
So it's very much like a sort of an infinite circle, in the sense that obviously it's a double-edged sword, in the sense that you need it sooner than later, because otherwise you're going to eventually get sicker and sicker, which means you're going to be more and more disqualified from receiving it. So it's so many moving parts to it, really.
There really is, and like it's ridiculous. Well, it's I get it why they do it. I understand why they have the standards in place, but yeah, like I said, it just makes it harder and harder the longer it takes for me to find a donor. The sicker I get, the less likely to receive a kidney. So.
Yeah. So because time is really of the essence, I guess you could say. Like, have they, as the health authority in Saskatchewan, have they communicated anything to you right now about when you can sort of expect to receive an operation? Or like, do they have a system in place where they can sort of give a rough estimate as to when it can happen, or is it just anybody's guess at this point in time?
Yeah, basically they don't have anything like that, and they won't give you a timeline whatsoever. I've tried that even when I was healthy enough. It's basically like the transplant doctor is the guy that says, you got the green light or you don't, and if you're not good to go at that point, then you won't get the kidney. But I did get a few figures from a doctor when I was very upset about losing my spot, I guess you could say, and my surgery date. And Saskatchewan is actually the worst province in Canada to have to get transplants or transplant success rates. We're about a 4% of, and typically every other province is at 16%. So any other province is doing 4 times better than Saskatchewan right now, which is really sad. So I don't know if it's with the healthcare crisis, or if the coordinating is not, or if they have too high of standards. I don't know, but I mean, that's a pretty big percentage, I thought, for success rates for transplant.
Yeah. So to explore that a little bit more, is there any avenue through the system that perhaps, if Saskatchewan's fallen behind on these transplants, are they able to say, well, okay, we're lacking behind a bit here, but British Columbia has got, an opportunity that we could perhaps send you for a transplant there. Is there any sort of that coordination between the provinces and the provincial governments to make that happen? Or is it just very much that you are isolated to Saskatchewan and hoping something comes up in Saskatchewan?
I tried that route as well. After my surgery got canceled, I looked into exactly that, like going somewhere else in a different province to get the surgery. And I was basically told I would get kicked off of the list, have to start all over in Saskatchewan, and I'd have to start from square one. And think I would have to be a resident of that province for at least 3 months.
Right.
So I up all that in Saskatchewan and have to wait another 3 months. I didn't think that it was worth the risk of getting kicked off because I should be kind of, if there is a list per se, I would be near the top of it due to my condition and how long I've been on dialysis. So when I get put back on the list, then maybe I'll be near the top. Whereas if I went to a different province, I'd be basically kicked to the bottom. So I didn't want to take. So I did explore that, and it didn't seem like it was worth it.
Yeah, that's understandable. And then, so if you're in Saskatchewan, then and forgive me, I'm not aware of how the system works in terms of transplants, but because you were so close last time to getting your transplant, I believe you said you were 2 weeks away. You were essentially top of the list, and then the government cancelled the surgeries. Once these surgeries start back up again and there's a match for you, is there a way to get you back to the top of that list, or are they effectively saying that, well, you were top of the list, but now other people have moved up the list and you're now at the back of the list, so it's a whole new system altogether? So do you still retain your place in that list to get the kidney transplant, or are you sort of at the back of the list now since they cancelled it?
Well, that's what I've never really got a straight answer from them. They more or less say, but it's due to these factors. So I guess if somebody was at the same stage as me, on dialysis longer than me, and healthy enough to get one, they would bump me down.
Right. Okay.
I'm not to be at the top, not, but I just they got to meet their standards and be healthy enough and to even get on the list. So I mean, that's hard enough.
Yeah, no, absolutely. No. And then, not to quote Game of Thrones either, but, winter is coming. It's always coming, November, December, January. We've all seen what's happened in the last, I would even argue, decade, whether it's cold, flu, or COVID-19. The winter is always a time when, cases rise, and it's not out of the question that we could see an increase in COVID-19 cases happen again once the colder seasons arrive here in Canada. So has the government communicated anything to you to assure you that what happened to you before in terms of your surgery being cancelled is not going to happen again? Have they put any sort of contingency plan in place to say, okay, that even if cases do rise in the future, we're not going to, put you to the back of the list, or we're not going to cancel a surgery if a donor is available for you? Have they communicated anything like that to you, or is it still very much the status quo right now, where the governments are like, well, whatever happens, happens?
Yeah, basically they won't give any guarantees about anything. I even went down to Regina, the legislature, to advocate for people in my position and try to get the suspension program back in order and whatnot. And now that it is, that's good. It took a lot longer than what they said it was going to, of course, but I'm happy that the people are just redeployed and getting back to their jobs now. But
and how well were you received by the government as well when you spoke with the legislature? Like were they understanding of your situation? Did they seem sort of ignited to say, okay, we can't let this happen again, we need to do something? Or was it very much just, a run of the mill sort of hearing and, nothing's really going to change? What was your take from it?
My take was, I think there are several people like me and in different situations as me, but there are several people that went and to advocate. And I think it did kind of give them a push to get the programs back up and running. Because it wasn't long after I went that they did actually start redeploying people. I think it was about a month after I was there and other people were there advocating for this. Because like I said, even people that were donating their organs, the people that had died in that period of time that wanted to donate organs, like all of that got wasted. And I mean, it wasn't just surgeries that weren't happening, it was organs that weren't getting, I can't think of the word right now, like or whatever. I don't know how to say it.
Yeah. It's been difficult nonetheless, though, to say the least. Obviously, like going through what you've been through and trying to get the government to listen as well. And, it's enough of a battle you're going through already without also having to go through a legislative battle to speak with, politicians and say, look, this is wrong. We need to do something to change this. So it's been just a never ending weight on your shoulders, I imagine.
100%. And like, I was even like pretty sick to be going on any kind of road trip, like even if it is only a couple hours, but it took a lot out of me. But I thought it was necessary to advocate for people like me and just to let people know that like organ donation is life-saving and it can change somebody's life, and it's important. It's very important to me anyways, and a lot of people around me.
Yeah, absolutely. I think that's the crucial point, is that obviously organ donation, transplants, it's life-saving. So it's important that whichever government it is, Saskatchewan government, provincial governments, it's important they take it incredibly seriously, even pandemic or no pandemic, because obviously people like you, like your life, that their lives are on the line, really. So totally understandable. And honestly, Jessica, we wish you the absolute best of luck for the future. What you've been through is honestly enough struggle and strife for a lifetime, I can only imagine. And of course, no doubt, us at secondstreet.org, we're rooting for you. People watching for this, we're rooting for you, and fingers crossed, thoughts and prayers, you can get your, a good match soon, a suitable match, then you can be on that operating table and get your life back to normal as soon as possible. So we're rooting for you, fingers crossed. And for those watching as well, if you want to learn more about our healthcare research and potential solutions to Canada's growing waiting list crisis for elective and even non-elective surgeries, visit us at secondstreet.org. We've got a bunch of information there, really interesting stuff. So please visit us there, secondstreet.org. Jessica, thanks so much again for joining me today. I really appreciate it.
Thanks so much for having me.
Thank you.